panel. So, Bill, the next up is we have our patient panel. What question would you pose to our patient panel?
Yeah, so my question for the patient panel, you let me think of this before, so is what do you want from healthcare?
Yeah.
And that's kind of broad because, maybe you want health, maybe you want, better access, maybe you want access whenever you want, but do you want healthcare? Healthcare is moving into social aspects of, to social determinants and thinking about that. What do you want from healthcare? You want us to do that kind of stuff? What do you want us to do?
Fantastic. All right, join me in thanking Bill.
So please join me in welcoming up our patient panel. Please join me, everyone. And as they come to the stage, I will introduce our moderator, Ariel McNichol. Ariel is the co-founder and CEO of ModiSpark, which is a personalized video platform that keeps patients motivated to learn and practice effective self-care by combining behavioral science, entertainment, and social video. Before ModiSpark, Ariel comes from Apple, LucasArts, Disney, Scientific Learning, and the Annenberg Institute, and she is determined to bring healthcare the persuasive design tactics that drive consumer engagement and behavioral change. Welcome, Ariel.
Thank you. That sounds much fancier when I hear you say it out loud. Yeah, I'm really honored to be here, and I'm going to let the panelists introduce themselves. So, Aileen?
Wonderful. So excited to be here. My name is Aileen McGraw, and I don't come from the industry necessarily. I lead an early stage startup incubator called WeWork Labs. We're industry agnostic, and we do have some healthcare startups there. Go Avenda Health, Vism, CardioCube, look them up. But I'm a type 1 diabetic and have really appreciated getting to know Cambia Grove and what they're doing, because I think my experience with chronic illness deeply affects how I experience innovation, how much I believe innovation promises, and how I think about the cost of innovation as well. So thank you all for having me.
Hi, there we go. My name is Bert Rosen. So I have a question before I give my own spiel. How many people in the room have seen a doctor or been involved with healthcare at all in the past year? Okay, right. So you're all patients, right? So do you guys want to come up and join the panel? So I was thinking about this a little bit, and no disrespect to anybody, right? But this really isn't a patient panel. It's really a Robin, Bert, Aileen, and
Ariel.
Shit. Sorry. Oh, I said shit. Is that awkward? Maura wanted awkward. There we go. So it's really a panel about 4 individuals, and I think that's the key. And I've worked in healthcare for about 4.5 years, which really opened my eyes and made me passionate about fixing it, because it's really fucked up. That's okay. And I think we all want to fix it. But for me, why I'm excited to be here is, again, I'm Bert, right? So I'm on a patient panel, but I'm Bert. So I have 2 kids, both in college. I have chronic Lyme disease. I have a hamstring soreness, right? Like, I have my own issues. I'm my own person. I'm not a cohort. I'm not a group. I'm not a patient. I'm not a patient ID, right? I'm an individual. So that's why I was actually really excited to be here today and to talk with these guys. So
I have a hamstring thing too. We should talk about that
later.
We should talk about that. Hi, everybody. I'm Robin Shapiro, and I've worked in the healthcare field for 25 plus years. But the reason why I'm really excited to be here today is I've worked in independent health advocacy, and this is a movement that is really designed to engage all of us in understanding, supporting, and asserting an individual's right to make medical decisions. And in fact, I wrote a book, and there are copies at the back of the room if you would like to pick up a copy for free. It's called The Secret Language of Healthcare: How to Ask for the Care You Deserve, because a lot of what's missing in healthcare is a patient or individual or person's ability to understand what to do. And we're going to get into that in the panel today. So thank you so much.
So the first thing I'd like to do is address Bill's question, which really is a great way to set up this panel. What is it that we want as patients? And I think originally it was termed a healthcare encounter, and we sort of scoffed at that. But then, Bill, you rephrased it as what do people want from their providers and from the interactions within the system?
And I love that because when we were chatting to prepare, one thing I was wondering is, what is a healthcare encounter? Is that, we were talking about working with billing. I, being a lay person in the healthcare scene, am like, oh, healthcare equals insurance. So is that what it means and stuff? Because I think of doctors, and Robin can speak really at length to this, as a relationship and something that is not quite transactional. So I think even the language and meeting your patients where you're at, like people, and thinking about the language you use of what we're looking for is quite important.
So when we were talking about that, an encounter is a very typical term, right, for a provider. And I was thinking, when I go and see my own doctor, I'm having a relationship with her. I expect her to understand me as a person, not just one aspect, my health, but actually everything that's going on. Now, is that an appropriate expectation? I don't know, but that is what I, as a patient, and what I see many patients walk into the doctor's office wanting. And I think it's really interesting to think about how the provider, the doctor, the nurse might be looking at that situation. I remember one time I had been going to the same doctor for a very long time, same assistant, and I was really stunned to realize that they really didn't know pretty much anything about me unless I brought it up in that time period, because there just wasn't the time to do that.
And for me, I think the big thing for me is a healthcare encounter has to be a part of my overall being or wellness, right? So or a healthcare visit, we need a lot of definition on the word healthcare, right? So I heard there's some financial planners in the audience. Is that true? Oh, maybe that's not true.
Oh, yeah.
Oh, there you go. So you're like, I would argue you're, it's close enough for my purposes, so thanks for raising your hand. Thank you. I would argue you're a healthcare provider, right? Like, how much stress is caused by financial woes for people? Like, what is stress do to the body? What is stress do to your overall health? So I want people, when I have meetings or appointments or whatever they are, to be with people who understand that there's a world out there aside from Western medicine, right? Because to be honest, Western medicine is 200 years old, right? And there's a lot of other things in the world that could potentially work. And so I'm looking for people who are open to thinking about how do you take care of Bert, and what does Bert do that helps Bert feel better. And I'll give you a quick story. So there's a woman named Morgan Gleason who's made some amazing YouTube videos for anyone who's curious. And I was chatting with her once, and she has a rare disease, a rare chronic illness. And I said, what do you want out of healthcare? And she said, I don't need to track my blood scores. I don't care about my other tests. I just want to ride my horse. And that's what I want anybody who I deal with in healthcare, in any realm of healthcare, to be understanding of, that I want to achieve certain life goals. And whatever it takes to get there, they need to be open to it.
So I'm going to try to paraphrase a little bit of what I'm hearing. So patients want a sense of an emotional connection with their providers where they feel understood, which brings all sorts of incentive questions up around, if they're seeing the same provider, are they going to clinics? It can be quite problematic when it comes to overbooked schedules, et cetera. But that is a base need for patients, feels like it's perhaps a really big problem. And then also being able to have the provider speak to the patient in a way that resonates with them as an individual. So understanding what their goals are, and creating a system where that kind of information could be bubbled up to the provider.
Can I give one quick example?
Yeah.
I'm sorry. I'll be fast.
Yes, go for it.
So I'm over 50, so I had a colonoscopy because that's what you're supposed to do over 50. And I go through the procedure, and obviously it's a big nothing other than the 2 days before it. So I get, I come out of it. My doctor says, yeah, we found a polyp. We removed it. Everything looks good. So I don't know, 2 months later, I get a letter in the mail, right? A letter in the mail. Who does that? From the doctor who says, well, we sent the polyp in for biopsy, and it's the kind that could be cancerous. So if you have any questions, call my office and come back in 5 years instead of 10. And it's like, that's what I got. Like, that's, and I don't have cancer, and it wasn't cancerous, but he used the word cancer, which is a trigger for everybody, in a letter, and told me to call his office. So, like, that's the perfect example of what to never do. So.
And sort of going off of that, I think it's about partnership beyond the office visit as well. Something I sometimes feel is that I'm handed off to Walgreens and I'm like, well, here I go. And, hope that deductibles are met and that my insulin isn't super expensive. And I would love help forming the right questions of how to push and how to ask for my affordable or making affordable the after the appointment reality is super, super critical. Many thoughts there.
And that's, Robin, maybe you could add on to that as an advocate and being able to bridge those gaps.
Yeah, I think it's an interesting time because I think most people are understanding that when you get sick is the absolute wrong time to learn about the healthcare system, right? And the independent health advocate movement is all about really having somebody travel alongside the individual, the patient, the individual, and seeing what they see in the road ahead and helping them decide where they want to go, what's important for Bert. And I think that in the future, people are actually going to have skills to understand where to push, what questions to ask, and who is on their team. So that can be a family member, it can be a friend, it can actually be this whole emerging field of professional health advocates who are typically former nurses, doctors, social workers that have seen the healthcare system and they understand the disconnects. And so they want to travel alongside the patient to help the patient get the whole person care that we feel like we all deserve.
And I was asking, not totally understanding how the advocacy world looks to get reimbursed and fit within the larger Medicaid and Medi-Cal populations. Is there like a future with advocacy under chronic care management, reimbursements, or like how as a system can we bridge this role so that, because it's shown to improve outcomes both for the patient and in a capitated market and hopefully.
So early years in terms of results on that, and I think in some areas there have been shown when patients can increase their confidence and competence in navigating medical decision making. There's research out of University of Oregon on the patient activation measure. You can actually decrease costs and increase results, but more study is needed for that. And definitely it needs to be incorporated into the system, but one caution is, we saw recently in the news the, Bert, remind me, Practice Fusion? Practice Fusion, does anybody know the story of Practice Fusion? Yeah, actually back-end artificial intelligence suggesting to doctors when to recommend opioids. And so when would a patient actually understand that that might not be necessarily the doctor's recommendation, his or her own thought in their heads? I think that we have to really think about who is standing up for the patient and going alongside that patient and can actually look at the whole system to help the patient understand all the different forces that might be at play in order to make an informed decision. I don't think we have that today by a long shot.
In some way, it sort of reminded me of how if you're brought to trial, each person gets, the defendant gets their own lawyer that's on your side, that's impartial, and that's built into the system. Whereas sometimes, especially in a kind of a scary fee-for-service world, you feel like it's not built into the system to have somebody on your side, and it can feel a little frightening. So one thing that we had talked about earlier, which is very exciting about having Aileen here, is this notion of patients know best, sort of what we need and want, and there are precedents of great innovation. And do you want to speak to patients as innovators?
Yeah, I think the one obvious fact I'll state is that there are many ways to reach the same goal of health and living my best life and self-care and all of that. And so in researching, I've had diabetes for 24 years, and I do not therefore keep up with innovation. There's no Google alerts or anything. And so when I was looking through over the past few months, I'm like, oh my goodness, there's so much going on. There's open source, the OpenAPS artificial pancreas system, which is, when done right and when you can manage your blood sugars, or you're trying to actively already in partnership with your endocrinologist, who is the expert at, what impacts a basal rate and how much and what kind of insulin to prescribe and everything, a way to close that loop so that you don't have scares during the night, or if you're unable to wake up from a low blood sugar. I'm lucky enough that I do, but very many people do not. This is a system that uses both glucagon and insulin to act like an artificial pancreas, which is amazing. And so, legal or not, you have people building these and improving their lives. Of course, the danger is there, and that's one, sort of question for the crowd, especially providers, is how do you meet patients where they're at in creating solutions, and in doing so Dana Lewis, the person who started the Open APS program and code and everything and research there, one of her TED Talks, she talks about we were done waiting, and this is what happened as a result. And I started thinking, oh my God, patient equals waiting. Like, that word means to wait. It means to just sit there, essentially, as a verbal metaphor. And I was like, how heartbreaking almost for so many people to think about, especially with chronic illness, as a wait. And so many restraints are there for good reason. Lives are at stake with chronic illness. But I think this idea of patience can be turned into urgency very easily on all sides of the table. Very easily is like a lie, but I'm using that as like a motivator. And I think that's critical because even this year there were horrific stories of rationing insulin and deaths, and these are people who are working as nurses or who are working as restaurant service staff and everything. And I think because of the hashtag We Are Not Waiting, I think this level of patient urgency is looking to see the same in the system. I see it sometimes, and other times I see. I would like to see a little bit more curiosity, or even if things have not been approved, talking through risks with me and ways to learn together and act together.
So Dana is a great example, and she was one of the first. And if people don't know who she is, you should look at the hashtag We Are Not Waiting, because it's still active, I think. And but she built her own artificial pancreas and built it open source so anybody else could do the same thing. And that's pretty amazing, right? And I think when you look at the world, right, and I worked at a company called HealthSpark for about 4.5 years, and we put on a conference called What's the Fix, where we wanted to focus on normal people who overcame healthcare obstacles despite the system, not because of it, and then drove change as a result. And Dana was one of our first speakers. We had another guy, Doug Lindsay. You should look for his story because he's amazing. He's gotten a bunch of press lately. He had a very rare disease no one knew anything about. And while he was bedridden, he researched it and found a surgery that they had performed on animals through veterinary science a while ago, and basically invented the surgery that they performed on him to save his life. And he was a normal guy. He might even been a marketing guy. I don't know that us marketing.
We're talented.
I'm a marketing guy in transparency. I don't know that we're normal, but he wasn't a healthcare professional, right? And I think one of the things you're seeing more and more now is you're seeing companies like WeGo Health. Hopefully people have heard of WeGo, or Savvy Co-op, who are really beginning to help patients and companies come together because, and I've seen this all over the place, in health IT and a lot of the innovation in healthcare doesn't involve the patient voice and doesn't let the patient ask the question and then try to solve the answer for them. And I think that's, you're beginning to see it more and more, but it's absolutely critical because, like you said, no one knows you like you know you, and you could theorize about diabetes all day long, but she lives it, right? So,
And I think I just want to go back to something that I said earlier, and that I think where we are standing is the need to partner more effectively with our providers. So we're not doing this without our doctors, really. So the point is to level the playing field a little bit in terms of getting our confidence and competence up to understand where we're missing and what we need to even be thinking about. So right now, people have not been very engaged unless you're facing a chronic illness, a serious illness. And then I hear over and over again, I came through this really intense time and I don't want another person to suffer the way I did. But how do we get those stories in the hands of people before they know that they need it? So that's really the question, is how do we wake people up to the very urgent need to get involved in your own health?
That is such a brilliant segue back to earlier when Bill was talking about the frequent flyers, and there's, I believe it's 70% of U.S. healthcare costs is due to behavior-related stuff, and in diabetes, the term clinical inertia, I think, was the theme of the American Diabetes Association's 2019 initiatives. Like, how do we get patients or just humans to improve their behaviors and feel that they have the knowledge and the access to safe housing and so forth. I mean, this is, as I think you said before, anybody can answer this, will win the Nobel Prize on the way out, but as if you can put yourself in the perspective of a patient that is sort of felt just clinically inert, what do you think helps? What could the healthcare system do to help you?
I think so. First of all, the healthcare system, we still have to define what that means, right? Because it could be the financial planners or part-time financial planners. It could be anything, right? I think so. One, we really have to define what that means. I think the looking at you and respecting that there's a whole lot that no one knows, right? Like anybody who says, here's another, the genius doctor who sent me the note after my colonoscopy, he said, "Are you on probiotics?" I said, "Yeah." He said, "Oh, no, it's not proven to work, so it doesn't really matter if you do them or not." Okay, that's his opinion, right? But that's so narrow. And so now what I do is I come here and tell you stories about the idiot who sent me a letter and belittled things that other people have told me work and I feel worked. So I think the openness is a huge thing, and I actually really believe it has to start in med schools, and I think med schools have to start re-looking at curriculum and start to look at broadening the definitions of a lot of these things. And I know there are some med schools that are beginning to do work around more patient centricity, like Dell Med School at University of Texas in Austin is a great one. Washington State's new med school is much more focused on people as individuals. But I think that's really where it has to start. And I think the generation of providers that's upcoming has to be able to not necessarily diagnose and say, go take these 4 probiotics, but needs to understand that it's something that might work, and just because it hasn't been proven through research that it does, doesn't mean it doesn't, and they need to respect your ability to do it. And again, with the financial planners, I think we need to really broaden what we think healthcare is, because to be honest, everything is in healthcare. Everything is healthcare. Everything you do impacts you or your life or someone else's life, and that's all going to impact your well-being. So broadening the definition to me is one of the keys.
And I think personally for my inertia, what stops me from taking action or booking follow-up appointments is not feeling heard in my entirety. It's, I am a broken record on this one, but some of the very simple, very clear skills that both patients and providers, I feel, can use is listening. Some of the most high-stakes skills out there, you have to be a listening artist and know how to do that. As one example, my twin sister is a tattoo artist, and she has to be a conversation artist. She has to coach someone through a very intense physical experience, make them feel welcome in her shop. And I think the same as doctors, and I don't mean that as like a funny metaphor. I think they're actually very similar in the kind of body space you need to create for someone. And I think that there's a lot of work to understand why it might scare me as someone coming from a low-income background, the price of these things, and maybe that's why I'm not, urgently booking in advance and stuff like that. I think there's a ton of race and gender aspects of empathy that caregivers and providers need to understand and put front and center. It's not that you don't get the system, it's that the system hasn't seen or got you, and I think there's this a gap we can definitely close and blend and make beautiful, not even into a gap anymore.
And I think I totally agree with you. And I think it would be really interesting if we all had some kind of rules of engagement. So basically understanding when I go and see my doctor and when I am not seeing my doctor, even what my role is in my own health. But something so that everybody, just like you know, get on an airplane and everybody understands, you know, the 2-minute disclaimer, which is really simple. It is really simple. Probably everybody in this room could state exactly the information that we all get at the same time. Some kind of framework so that we all know where we're starting from and that we all know that it's all of our mutual responsibility for patient safety. I think it's not all on the patient and it's not all on the provider and it's not on the system. So mutual rules of engagement I would love to see.
I don't know if any of you have been fortunate enough to have a really great insurance company, usually self-insured employers that have benefits like gym memberships or nutritionist access. But if any of you have or you know of some, do you think that's starting to like broaden the definition of healthcare by bundling these seemingly ancillary services like nutritional counseling and smoking? Smoking cessation's obvious, but
No.
no. Okay, so they're not succeeding yet. Okay, another
Or
question.
I would say I was lucky enough, shout out to Microsoft, my first employer. The reason I moved to Seattle has amazing benefits, but they're not, to my knowledge, I am not the expert. They're not all from the same place, and so that's sometimes great. You can get wellness coaching from Limeade and your Stay Fit benefit, and then Premier Blue Cross, bless you, amazing for diabetics. I'm sad to not have you anymore. But it does feel like my hands are in a million places, and I know we have Livongo, but I don't know what that is, and I know it has to do with diabetes, but ... That's as much as I know, and I think that's a point of when you have so many options. Yes, I see you seeing me, and I want to tap into all of this, and not to be a snowflake or super millennial about it as well. I'm also like, can we make this a little easier or more immediate or integrated, which is a high ask, and I completely understand that. But I think that's a cool opportunity is how do you make this detailed yet simple, challenge the system but make it easy, and all of these dichotomies that will have to be confronted to
Maybe
do so.
everybody needs a healthcare advocate, like to help bring that, because it is a profession. It is hard. I mean, from people just maintaining their health, let alone complex conditions.
I like to say that everybody works in healthcare, just some people get paid for it.
I learned recently.
Wow, I love that.
That
It's true.
isn't it that there in Medicare there's some fraud problems, but that home caregivers can get paid for once they take a class to take care of their family members that qualify. It seems fascinating. Yes.
And we need to be teaching everybody, all humans should have basic skills around how to ask for the care you deserve. Just the most basic things people don't understand. That's the Washington State Health Advocacy Association, which I co-founded and chair the board. We're trying to create easy content like the ABCs of an effective doctor visit. It's universally 100% of people say that they find it to be of help, and it's 60 minutes of time for very, very helpful, specific, detailed information about how you can make the most of that time that you have, both in the doctor's office and not in the doctor's office.
That's awesome. So I want to go back to Bert, something that you started talking about, which is personalization. I mean, it's like the buzzword, and I think you have some great kind of opinions on what does that mean? What do you want out of the healthcare system as a patient?
I have no opinions. So personalization to me is the bullshit word of this century, right? Like it's like strategy. It's another one of those words, right? It's when personalization's, I started in digital in '99, and personalization was having hi, Bert in an email. And when you think about it, right, like that's people, so I mean, it is personalized technically, right? But does it actually add any value to me? None whatsoever. So I'm actually trying to not use the word personalization anymore. And I mean, I'm a marketing guy, like I said, so I need to come up with a better word, but I've been using more individualization because, back to that story about Morgan, who just wanted to learn how to ride her horse. Like I used to go mountain climbing, and since I've been in treatment for Lyme, I can't, but I really want to go climb mountains again. So, I hope that my LDLs are, I don't even remember, good or bad, whatever they're supposed to be. I hope my Lyme counts come down. But what I want to know most is how does Bert go out and do what he loves, which is climbing mountains? And I think personalization is has become a technology word and a technology answer. It's like, oh, this platform is personalized, that's personalized. But what it's not is individualized. So it still doesn't talk to me the way I'm made up and the way and helping me achieve the goals that I want to achieve as an individual.
And I think to go back a few steps, that at the design stage, being very intentional about your end user, AKA the human, AKA the BERT, that's going to be experiencing the care, the hardware, the software, etc. Like an example I gave was, my wonderful insulin pump is great and literally a lifesaver, but the sensor I wear that pairs with my phone, it's not integrated, but that's by my own choice. I could integrate it, but the way it was way too clunky, and it just did not work for me. But when I go to work out, for example, my sensor will not make it through Barry's boot camp. It just sweats off, and I'm like, no, hundreds of dollars down the drain. And I don't mean to make light of that. It's extremely expensive, but exercise is very important to managing diabetes. Or type 1 diabetes for me, and so everything from yoga, where I'm upside down being like, fingers crossed it doesn't fall, there's so many endless examples of, or wearing a skirt, I hope that this skirt band is like thick enough and tight enough so that my pump doesn't drag it down. Forget a dress, it's like, what underwear am I wearing to make sure that this stays put? And not to go TMI, but I think there's so many hoops that as a human who is active and wears dresses that I'm like, maybe this was designed for someone else. While, of course, immensely grateful for life-saving technology.
But you're too nice. Honestly, you're too nice, because it was designed for someone else, and they probably didn't have you as a use case when they were designing it. And that's a huge, colossal miss. So don't be so nice. Don't let them off the hook.
won't.
I mean, seriously.
Yeah.
Do people in the audience have any stories that they want to share about maddening incidences in their recent healthcare?
Yeah. So my daughter had a sleep issue, and the physician referred her to a surgeon. He's supposedly a sleep expert. I should have realized his office is right under the Four Seasons in Palo Alto. So we went there, and he said he wouldn't take any insurance. But he was in the early consultation, he was the guy who said, she needs her tonsils removed. And so at this point, he said he wouldn't take any insurance. What do I do now, right? I've already in the system, he's been referred, built a connection. He said, okay, it was $9,000 was his fee for 2 hours of his surgery, right? And when the medical bills came, our insurance company wouldn't pay about 4% because he was out of network. And I appealed, didn't work. So how does this happen? I can't really shop. That's what the insurance company said. You should have gone and shopped, but I've already sent down the pipe, to this guy. I'm not going back and repeat this all over again, and I don't even know where to find the real price.
Great question. And, we as patients and family members need to have basic information about, instead of just saying yes and done, cueing us to say, and let's get a second opinion, and here's how to do it. And here's the barriers that you might feel in getting a second opinion, because that's real too. Patients are often really afraid to get a second opinion, especially when their life is on the line and time is on the line. And so, but those are very basic skills that any patient and family member could have. On the price part of it, it's really, really tough. There's new law that says that all hospitals need to post what the cost of their surgery and different things are online. And so has anybody tried to do that? Has anybody tried to look at that? I'd just be curious. Okay, one person. And any success? Was it clear? No. No. They've done it. It's a PDF of pages and pages, because I actually did it because I was curious. Well, could I really find out how much a colonoscopy costs? Pages and pages and pages. So we have a lot of work to do.
You know, and I worked in pricing transparency, not for the hospitals, but through payers. And you're exactly right. Like, I actually worked at a pricing transparency company. I was at a doctor who said you need an MRI, right? So if I was a good employee, I would have said, thanks, I'll be back, gone home, gone through the website, hopefully it was working, looked at MRI costs based on my benefits, and then found the cheaper one. But he said, we can get you in 10 minutes downstairs. So he wins, right? And with you, you got yourself into a situation where you found a so-called expert who told you what to do, and you trusted him because the referrals were good. So, you know, shopping is a little bit of a misnomer. There's like, people in healthcare, and you want it a little bit awkward, right? But the payers of the world have expect that people can go from zero knowledge of healthcare with no support, not understanding the language or anything else, to shopping for different healthcare services. And that's just like, that's going from A to Z,
Maybe,
right? Without B,
yeah.
C, D, E, F, G, whatever else comes after that in the
It
middle.
would be
And
great if maybe there was a framework during appointments where they were it's part of it where they're forced to be transparent about costs as just protocol built into the visit.
And put it in the context. Like, if he was really great, he would have said, well, my fee is $9,000. Actually, the fun thing is go to the doctor and ask them what something costs they don't know. But you can say, you know, if he said it's $9,000, but that's also because I'm really well known in the specialization, but there's other people here that, right? But it's just, the world isn't set up that way.
Yeah, I mean, when you go, for instance, we've had experience at Children's, and they do have the financial disclosure, so they're ticking the box in terms of what they have to say, but in terms of, do you understand this? These are your rights, and basically, it's just a check mark. So how do you get beyond that to real knowledge? So you know what your choices are.
Like, are we still sharing about horror stories?
Yeah, we could, sorry, I think we have about 4 minutes left. So questions or horror stories?
Oh, okay. So I'm actually my background's in nursing. So I recently had an experience with my mother-in-law, fell down the stairs, broke ribs and her wrist. So I was helping navigate them through days in the healthcare system, and I could go on for an hour, but it was one thing after another. Got to the ER, they were giving her PO pain pills. I'm like, can we get an IV going, get some IV meds? The content expert for the tech wasn't around, so the people were fumbling around, dropped her hand out of the holder where they were setting the splint. We go to the orthopedic surgeon. She says, I'm not a pain management specialist. Your primary will deal with that. We get to the primary appointment. Primary says, no, she's responsible for that. And it was just like this one after the other series, and it was just very difficult to watch, but it was very helpful for them. But if they had said, if I wasn't there, they wouldn't have had a clue how to navigate through that whole system. And this was in their network system too, so it was crazy.
Don't ever go to the hospital alone.
Hi, I'm John Kim from the Pacific Hospital PDA. Just a reflection on what Bert was saying earlier, just as, health is not an objective, it's not a goal, right? It's a resource for everyday living. And so too, seeking services from the healthcare sector is not about receiving services. The goal is about actually getting health. And I think that when the system has become so sophisticated and so knowledgeable, it makes it hard for a patient to be a partner in achieving health. And so, it might be a right, but what about the responsibility? And how do we address the issue of creating a greater sense of responsibility in each and every person to be part of that equation to achieve health as a resource for living and not an objective, and certainly not a service?
That's a great question. You know, I keep getting, I don't know if anybody else gets this on Facebook, I keep getting ads for a mug that has a big Google logo on it, and it says something like, thank you for not confusing your search on Google with my 10 years of medical training. But I think right, that's the point. The goal isn't health care. The goal is living your life differently and better. That's a $1 million question.
I mean, I do think that mutual rules of engagement where there's some expectation of a mutual conversation would be a really different way to approach our healthcare experience.
I think there's also a lot of research now around shame and reducing shame to help build a sense of personal responsibility in patients, that when they feel like they've been should upon by their providers, it sort of has the opposite effect.
And I so agree with that, and I appreciate you calling me out for being nice, because I think one thing I've been conditioned to do is to be grateful for access to care, which I am, and I'm also incredibly frustrated, and I think have a right to be so. And part of the shaming, I think, is knowing that your discipline is one part of your patient's life and body, and that it intersects so many others. I had a pediatric endocrinologist make a comment that ended up impacting my health in a very serious, life-threatening way. This was not, it was more like mental and the results afterwards that had impacted that. But I'm like, if they could have thought about how that would come off or thought about word choice, I think the simplest things, empathy, listening. I wish healthcare were smaller. That way we could do a feedback roundtable and document all of that, no patterns, and deliver a solution. But one of the last things I'll say is that coming from marketing as well, this idea of NPS or a net promoter score is one buzzword I hate. But also think about that, you are a brand and you have a responsibility to want to be recommended by your patients. So what are you doing to earn that trust, to have them be your advocates? And I think that is something that fuels me in my work every day. How can I help startups and founders not just endorse my work, but grow and appreciate that? And I think that idea of how do I fuel advocacy, appreciation, engagement, retention, and all of the business things as well. But
Right. This is so exciting because I think there's so much more to say. We have time for one more question, and then all day we should have the patients in mind.
I wanted to speak as a primary care physician in the community. I've been practicing for about 24 years and have gone through my own evolution as a provider. And I started my career with going to public health school to get the larger perspective, and moved through primary care, pretty much practicing the usual way, the fast visits, the doling out prescriptions, the sending people on referrals right and left, and became very frustrated and have always been more open-minded with looking at integrative approaches, other approaches to treat disease and achieve wellness for my patients. And I ended up finding an approach called functional medicine. How many of you have heard of functional medicine? So functional medicine is a root cause approach, and our system has evolved into one that is very disease focused, and it's based on the great successes we've had in acute care medicine in the emergency room, where we can stomp out disease very successfully and stomp out symptoms or conditions. But what we've done is we've taken that acute care model into the chronic disease realm, which is what most people are suffering from day to day. And we've taken that name it, blame it, tame it kind of approach without getting to the root causes, without hearing the whole story of the patient. And so what we do in our approach, which is a very science-based biochemistry, systems biology-based medicine, where we see the body as connected inside, like, believe it or not, a migraine can be connected to gut issues, that knee issues can be connected to gut issues, and so forth, that we take the time, and that's what's missing. And I've been fortunate enough to be allowed to do that in my system for the last 10 or 11 years. And what I've found is that when people are heard, when their whole story is heard, much of what may be going on for them as an adult is because of what happened much earlier on in their lives. And when that's half the healing, to be heard. and that also when we're looking at root causes, and that probably 80% or more of chronic disease is lifestyle preventable. And when we look at the lifestyles and we look at the forces upon people, maybe pushing them into those lifestyles, and we start undoing those with our clients, patients, and we educate and we explain. So many people don't even know why they have what they have. And so I know I need to shut up, but I just wanted to speak to that. It's not just about more access. It's not just about, more information. It's about changing the medicine we're delivering to patients.
What you're saying, it sounds like heaven. It sounds. I'm sure we would. I'm sure your mom would have been very fortunate if she had gone to see her. But anyhow, yes. So now we have one question that we would like to leave for the next panel.
So I've memorized, so providers can't know every solution that exists in the world. There are so many. So how do you partner with patients to address their health would be our question. And I want to give a shout out to Christine Monkhouse. Patient Orator is doing so much with patient stories and really bringing those voices to life. So if you're curious about that, everything you just said really resonates with the business she's building, and connect.
Absolutely. Great plug. Thank you, Christine, for your work as well. And thank you to the patient panel. What a wonderful way to set the tone.